Hi guys, so it's coming into this season where we're seeing a lot of chest infections coming in through the doors. A lot of asthmatics, a lot of children who aren't able to get rid of the secretions themselves. They've been to their doctors, they're having antibiotics, and they're just finding it very difficult to clear. I'm an asthmatic myself, so I know exactly what it's like, and I know how much chest physio can do to really clear, the chest out. So the first thing I would do is listen to the chest. So I'm just going to pop in these. And we're just going to listen to the upper lobes of the lungs. So big breath in for me, Kira. And out. And the other one, big breath in and out. And then we're going to listen to her lobes on the middle and out. And the other middle lobe and out. And then I'm going to listen to the bases at the back and out. And the other side and out. And when I'm listening, what I'm looking out for is secretions, wheezing, crackling, crepitus, and that's what we're then going to remeasure after we've done the chest physio session. Now, the other thing we look at is with a pulse oximeter, we look and see, we just pop a finger in there, and it gives us a reading of heart rate and actual oxygen in the blood. So if we see the oxygen really dipping down below 80, we know that their airway is restricted, and so she's 67 of a heartbeat, that's a very good heartbeat, and 98%. So we are hoping to see it in the 90s, when people are well, but yeah, you can really get restriction. Once they go below 80, you're beginning to get a little bit worried about them. Now, the other thing we use is a peak flow meter, and this measures millimeters per second to how forceful you can blow out. So I'm going to get Kira to take a big breath in and a big blow out as far as you can. Keep going, keep going, keep going, keep going, keep going. Okay, so she's getting 350, so that's a little bit low for Kira. So normally, myself as an asthmatic, as an adult, I get about 450, and somebody who's very athletic can get up into 500 and 600s. So again, you can use this every session they come in to see where their chest is actually at. So we have an actual measurement of that, which is great. So I'm just going to show you the chest physio then that we do. So we get Kira to sit up straight, and I'm just going to tap. So she's taking big breaths in as I'm actually clapping the chest, and this is for the upper lobes, and it's really good at clearing. Then we'll get her to give a big huff, so big breath in and huff, and we'll put a little bit of compression to try and clear the lungs a bit more. One more for me, big breath in and out. Good. Now I'm going to get you to lie face down with your head through the breathing hole. So then we're going to do her bases, and again we're clapping while she's taking deep breaths. And usually with this type of physio, it's about 20 minutes after the session that the secretions will start coming up. It's called the active cycle of breathing technique with percussion. That's what we're doing. So we would do that for a couple of minutes. Then we'd get her to turn onto her side facing away from me. And you could bring your arm just ahead there, Kira, and we'll get her middle lobes again. And you would spend a good few minutes doing this. And then you would go and retest their listening to their chest, the auscultation, and you would redo their peak flow and record it. And then you would see them, maybe once a week, maybe 3 times a week, depending on how bad they are. But that's chest physio. So if you know anyone that's suffering with chest infections, give them our number 043 333 1792, or tell them they can book online at www.mirandamornphysio.ie. Bye.